Okay, so this is looking at video 9, which is treatment and psychological disorders. So, psychotherapy is a treatment that involves psychological techniques, and it consists of the interaction between a trained therapist and someone seeking to overcome psychological difficulties or personal achievement. And there's what's known as the eclectic approach, where you use a variety of techniques with different, obviously, strategies. So there's different types and techniques you can use. So there are four that are listed there. Is you could take the psychoanalytic approach, you could take the behavioral approach, the humanistic approach, or the cognitive approach when you're looking to use different types of therapies. You could also conduct it in a variety of ways. You could do it in group setting, you could do individual setting, or you can do it in couple setting. The eclectic approach believes that you could use a variety of the different types to help treat an individual. We'll first look at psychoanalysis. So, psychoanalysis was Sigmund Freud's therapeutic technique. He believed therapists help individuals interpret their repressed feelings, allowing them to gain personal insight. So he uses free association. He needs to be aware of resistance. He looks at dreams. He also wants individuals to be aware of transference. So, the basic description, it was the first psychological therapy. It allows people to uncover their unconsciousness. The time, it could be very time consuming. Usually, you need 3 to 5 treatments a week over years of therapy to really uncover the unconsciousness. He believes that the conflict people have is anxiety, and it's a root from repressed sexual urges or from aggression. The role of the therapist is unemotional and to help the patient uncover those conflicts. And the goal is to identify childhood conflicts and traumas that have affected adult life. Different techniques that you, or in key terms that you should remember with Sigmund Freud, is to be aware of defense mechanisms. Freud believed that repression is a basic defense mechanism. Other include repression, reaction formation, projection, rationalization, and displacement. All those serve to reduce anxiety. And it's helpful for a therapist to recognize individuals using the different defense mechanisms and to bring it to the individual's attention. Freudian slips are also used, which is allowing the unconscious to slip into the conscious awareness. Those slips of the tongue can also help the client and the therapist, and helping the therapist get to know the client. Also, it's helpful to look at wish fulfillment. Remember, it's the dream theory, where it believes that it's the opportunity to discharge the unconsciousness, which is our wants and desires. He believes that all of us have a manifest content, which is the dream storyline, and it uncovers specific meaning, which is the latent context. Neo-Freudians today have adjusted Freud's theory. Alfred Adler is a very popular Neo-Freudian, and his goal is not so much to focus on the unconscious childhood urges of the sexual urges and of aggression. He focuses more on the social impact of a development. He looks at the family and how the family dynamics can influence. Birth order is another one that Adler looks at. Techniques to be aware of. There's this idea of transference. Transference is the process by which patients transfer their emotional and conflict towards others in their life or towards their analysts. So transference also can occur when an individual takes out their anger on the therapist. So the therapist might remind them of their mom, and they transfer their aggression onto the therapist. Free association is allowing the client to speak freely about what's on their mind, and we've talked about that in class. Interpret, in psychoanalysis, the analysis notions, suppose dream meaning, resistance, and other significant behaviors and events to promote insight. So they try and interpret what's taking place with the individual. And oftentimes resistance does take place. It's the point, what point do patients start to become reluctant about talking about certain topics, whether it's their childhood or their mother or their father. And these are the points that cause anxiety, so they refuse to talk about certain ideas. Behavioral therapy is another type of therapy after psychoanalysis that could be used. It's a therapy that applies the learning principles to eliminate unwanted behaviors. Oftentimes, it's used with addictions. You should be aware of the different behavioral therapies and the ways in which we learn, which are also often used to help with therapy. So we talked about classical conditioning, operant conditioning, and social learning model. So the basic description of behavioral therapy is to focus on changing behaviors rather than thoughts and feelings. So it's focusing on changing the specific behaviors, biting your nails, wetting the bed, etc., versus having a negative feeling about yourself. The strategies is looking at rewards, punishments, and modeling to help change the behavior. It emphasizes behavior modification, like shaping, gradually getting them to perform certain behaviors. Um, and systematic desensitization, which we'll talk about, is a way of changing the behavior over time. It often works well with people who have OCD, anxiety, and phobias. People to consider which helped with this one were Ivan Pavlov, B.F. Skinner, Watson, and Bandura, all behaviorists. So different types of techniques they use with behavioral therapy is what's known as counter conditioning. It's a behavioral therapy procedure that uses classical conditioning to evoke new responses to a stimuli that are triggered by unwanted behavior. So this includes exposure therapy and adverse conditioning. So oftentimes you may pair something negative to create a more positive experience. So you're pairing a rubber ducky, let's say, with the pool experience. The rubber ducky elicits a more positive response. So instead of the fearful response that the pool once initiated, the rubber ducky then can be paired with the pool, which can bring about a more pleasant response. Exposure therapy is an example of counter conditioning. Exposure therapy is exposing people to an image or an item that they may be trying to avoid. So, a person that's afraid of dogs, you may show them an image, okay, and gradually expose them to a dog or to a situation to get them more accustomed to it. So, you may have a fear of planes and you gradually expose them to that stimuli. Another one is aversive conditioning, and you're linking the unwanted behavior to an unpleasant state, so they will be conditioned to avoid it. Oftentimes, this is used with people who have a drug addiction. So, the unconditioned stimulus would be the drug, and the unconditioned response would be the nausea. They may then pair the drug with alcohol, which once would trigger a happy response. So then every time they think about alcohol, they actually think about being nauseous, so they avoid the stimulus. Another one is systematic desensitization. Systematic desensitization is the progress exposing the patient to a fear or anxiety, producing a situation while relaxing in order to extinguish the behavior. And a process that oftentimes this is a gradual process to get them to become accustomed to the stimuli. So you gradually get people moving closer to the stimulus. So you may show them, if they have a fear of dogs, you may show them a picture of a dog. Then you may show them, have them be in a room with a dog, and then they'll gradually be around dogs. Flooding them is exposing a person to a fear or anxiety all at once. It's meant to show the person they can survive even if they're around this stimulus. It's a quick approach to throw a victim into the situation. The last two are virtual exposure therapy and token economy. Virtual exposure therapy is to put somebody in a simulation of the environment to get them accustomed to the stimulus they are avoiding, to show them that it is not a fearful situation, and to have them relive the event. And token economy is every time there's desirable behavior, it is reinforced with an object or a point which can be accumulated or exchanged for various rewards. Oftentimes, this is used in schools.